Me talking about the RAAS system, which is the renin-angiotensin-aldosterone system, and two types of blood pressure medications that help lower the blood pressure. So the RAAS system is used to increase blood pressure. However, sometimes it can be too high and medicine is needed to bring it down. So typically, the way this system works is when there is a signal of low blood pressure, the body releases renin from the kidney via the juxtaglomerular cells, and they react with something called angiotensin, which comes from the liver, to make angiotensin 1, and then angiotensin 1 is quickly converted into angiotensin 2 via an enzyme called ACE. And ACE comes from the lungs. And so when it is converted to angiotensin 2 is actually the substance that actually increases the blood pressure. So it does it two ways, two main ways. It goes into the blood vessels and causes for vasoconstriction, and then it also stimulates the adrenal gland, which causes for aldosterone to be released, and this causes for reabsorption of water and salt in the kidneys and the excretion of potassium. So normally this works, and it sometimes works too hard and causes for high blood pressure, hypertension, or kidney failure, or heart disease. So one way to help lower the blood pressure is via a ACE inhibitor, which works right here between angiotensin 1 and angiotensin 2, and it basically just blocks angiotensin 1 from become converted into angiotensin 2. So it basically blocks an enzyme in the body called the angiotensin converting enzyme. So ACE relaxes the blood flow by blocking the conversion in angiotensin 2. This lowers the blood pressure, and it also protects the kidneys by lowering and reducing the stress on the kidneys because less angiotensin is being produced, stimulating the adrenal gland and causing for less aldosterone to be produced. So the second way is the ARBS, which is the angiotensin receptor blockers, and this works after angiotensin 2 is made by angiotensin 1. And what makes it different is that it targets specific receptors on cell surfaces, which is AT1. So this, by blocking right here, it doesn't cause for vasoconstriction, doesn't go to angiotensin 2, doesn't go to the blood vessels, and doesn't cause for vasoconstriction, or less of it. And also less of it goes to the adrenal gland, and less aldosterone is produced, and so less of the reabsorption occurs. So some of the potential side effects of these two medicines are, the main one is it causes for a slight cough, and this mainly is in ACE inhibitors, which is likely due to the buildup of bradykinin, and also the ACE and the ARBS causes for angioedema and hyperkalemia, which hyperkalemia is the increase in potassium levels, which is just from not enough excretion of potassium, so there's just like a bunch of potassium. And angioedema causes for swelling in the face area. But these can often be regulated and reduce the amount of medicine taken. But yeah, these medicines are both used for helping prevent too high of blood pressure and preventing kidney failure and heart disease.